day 10 of our training session on this online facilitation. I do hope you have had some great encounters over the past days, and today we'll be taking 3 sessions on this module, covering community health and safety, environmental health assessment, and healthcare waste management. It's expected to be module delivered through presentations, group exercises, as well as an end of course test and trainer evaluation, just so we are able to have a feel of what you've experienced over this couple of days. So, session 1, community health and safety. This is environmental standard 4 of the environmental social framework, and it's focused on our outline for the training or the module will be having introduction to the topic, definition of terms, linking this topic and the environmental social framework, objectives of the ESS4, elements of community health and safety, common community health issues, and emergency preparedness in communities. So, what do we want to achieve at the end of the day? You'll be able to define what community health and safety and enumerate its importance, explain environmental and social standard 4, its objectives and focus. Also explain what community health issues of importance are, and list certain steps involved in emergency preparedness in communities. At the end of this module, it is expected that you will be equipped to develop positive health and safety culture in your communities and in all activities, promote health and safety in your communities, ensure you are not affected by hazards from the work you do, and you have capacity to initiate emergency responses in events of accidents or incidents around you, and advocate for improved health and safety protocols in the country or in your community. So, from the very basic, the World Bank Environmental, Social and Social Framework, developed in 2018, is a commitment to sustainable development, where the environmental social standards are designed to support project activities with the aim of ending extreme poverty and promoting shared responsibility. There's a vision for sustainable development, and there is a environmental and social policy for investment financing of projects, which the World Bank supports. The whole aim is to ensure that there's a shared responsibility in project delivery between the financer and the beneficiary. So, just a recap, there are 10 environmental and social standards as listed, but we are focusing on the 4th one, community health and safety. Just a pictorial representation of what they look like, and what is community health and safety, or what is the community. A community can be described as a group of people who have shared ideologies, like shared boundaries, have a sense of membership and culture and language, have common norms, have common interests and common values, and work together to achieve all of this. Members of a community typically experience shared reality as they live and work, and they always relate to achieve social, economic, and physical empowerment, as well as remit all the risks related to all of this in the environment. In a healthy community, communication and collaboration is key, so that everyone plays a role in ensuring all is well. So, what is community health and safety? Community health and safety refers to the processes and procedures used to protect local communities from hazards caused by or exacerbated by project activities, which could be flooding, landslides, contamination, or other natural or man-made hazards and diseases. For example, during construction of dams, there could be a collapse of agriculture, or damages to rivers, or all some of the natural habitats of communities. So it is important that people are protected from such consequences of project deliveries. So, environmental and social standard 4, community and safety, focuses or recognizes that project activities, equipment, and procedures can cause communities some damage or can increase risk in communities. In as much as these projects are expected to provide good dividends, there may be some risk, like I've explained previously. So communities are expected to address the health and safety and other risks, and be aware of them when there is an intervention project in their communities, and work together with project supervisors or project coordinators to achieve a safe and good working environment. So what are the characteristics of a healthy community? A healthy community is one which all the residents have access to good quality education, safe and healthy homes, adequate employment, transportation, physical activity, nutrition, and generally have a good quality of life. So communities that are healthy make it easy and convenient for people to be physically active, have a clean and safe environment, have good investment in education and empowerment, and access to affordable healthcare and other social development needs. So we need to know what a healthy community is, or what we should expect in our communities. It must be clean, safe, free of all issues that will limit productive outcomes. And some of the common community problems we have are peace and disorder, human and waste disposal, food security and sanitation, water supply, drug abuse, and disease control or disease prevention. So these problems are things we face in our communities. They may be more in one place or they may be few in another place, but overall, some of them affect our communities. So we will be discussing on this in your communities. Maybe you list the attributes of your face as of the communities where you live and work that make it a safe community, as well as some of the things in that community that make it unsafe or seem to impair your health and safety. This is a discussion. We will take it up in our chat, and some of the videos here for you to play and see, understand better what it's expected of you in the community to promote its health and safety. So as we all know, project activities oftentimes lead to some emergency situations that may affect community members or even the project providers. So it's important that we all are aware of our roles in promoting safety and responding to emergencies. So what is an emergency? An emergency is an urgent and unexpected and usually dangerous situation that poses an immediate risk to health, life, property, or environment and requires immediate action. It's usually sudden and there is need for quick response. So emergencies can be natural, can be man-made, and can be technological. So some types of emergencies we have are severe weather conditions, fire outbreaks, hazardous materials, chemical, radiological emergencies, road traffic emergencies, domestic crashes, and civil disorders, as well as public health and medical emergencies. So there is a pattern of responding to emergencies or emergency management. We have the 4 phases of emergency management: mitigation, preparedness, response, and recovery. And it's a cycle, it's a continuous thing. So you must prevent emergencies and be prepared to respond to them, know what to do, how to go about it, and recover from emergencies, and continue to look forward to how you will respond to future emergencies. But overall, it is a cycle, so it's a continuous thing. None breaks from the other. So emergency management seeks to promote safer and less vulnerable communities, and we must understand that everyone is involved in emergency management because you need to coordinate and integrate relevant activities and sustain and improve capacity to mitigate or prepare or respond, as well as recover from such disasters or conditions. An emergency response plan lays out the various steps to take during critical conditions, and people are meant to address various types of emergencies. As we know, each emergency comes with its own pattern, so it's not a one straight jacket approach to respond to every emergency. As the situation presents, there are certain processes or procedures to adopt in responding to them. A plan suits the emergency that is at hand or that is presenting. So we must have basic steps to know how to respond to it. So in mitigation, you have to prevent emergency, reduce the chance of that emergency occurring, or reduce the damage that the emergency will cause. While in preparedness, you plan to save lives and help in the rescue process. Preparedness is your capacity to address action before the emergency occurs. While responses is the various actions you take, like rescue, like transportation to healthcare facilities, like calling ambulance services, and all other activities that will ensure there's a timely response during an emergency. And of course, recovering from emergencies, which could be environmental or medical or community wide. But there must be a situation where you have to recover from that emergency and move on with life. So at the end of the day, community health and safety is very important to ensure that people are safe and go about their daily activities. And it's everyone's responsibility. It's not the responsibility of government alone. It's not the responsibility of healthcare workers. It's not the responsibility of environmentalists. Everyone is responsible for community health and safety. And so everyone must be prepared to take action. Actions that differ depending on your level of stakeholdership in the situation. But all must put hands together to promote community health and safety. And there are national and international guidelines or national and regional laws that guide best practices in the industry. So everyone must be responsible to promote community health and safety. We need to understand that the World Bank has brought this out so that it's before us, and we must understand our roles and responsibilities in promoting community health and safety. You may refer to the course materials for more details so that you have better understanding while we continue the discussions on the online platform, so that we share more robust ideas on various ways to promote community health and safety. So we continue with session 2, which is environmental health assessment. This it's about promoting health in the environment, understanding the pillars of environmental health, knowing some of the effects environmental factors have on our health, and promoting steps. What are the steps we take when we want to conduct environmental health assessment? So at the end of this, you should be able to define environmental health, list the pillars of environmental health, enumerate effects of the environment on health, explain environmental health assessment and its importance, and identify the steps in environmental health assessment. So, good health and well-being requires a clean environment, which is obvious. The World Health Organization defines health as a complete state of well-being, environmental, social, physical, psychological, and not just the absence of disease. So you need a good environment to promote your health and well-being. And the environment is a source of improving our living conditions and increasing well-being. We should promote the principle of prevention is better than cure, or even cheaper than cure. Because when you address the environment, a lot of conditions or our illnesses are also taken care of. Everyone is responsible for the environment, and everyone is vulnerable during environmental risk. So we must have a role to protect. But of course, there are special groups of people who are more vulnerable, and these are also given priority attention. So what is environmental health? Environmental health is a facet of public health that focuses on the relationship humans, plants, and animals have with the environment, including living and non-living things. Environment addresses fresh air, clean water, shelter, sustainable climate, just to mention a few, so that we have this working together for the well-being of man, plants, and animals. Individuals and communities get directly affected by the quality of environment they live in, and are also involved in the management and promotion of the good environment. So environmental health is important because our safety and our well-being is hinged on the quality of the environment around us. So what are the benefits of environmental health? We have clean water, cleaner air quality, reduce hazardous waste, increased access to food and food security, safer outdoor conditions for adults and children, improved population health, improved health equality, just to mention a few. There are various many other benefits of environmental health. And the pillars of environmental health, community health, which we just talked about in our first session. We must prevent disease, we must promote health and safety, we must promote population health in the community, we must have food safety and hygiene, and there's population control, there's occupational health. No matter what the work you do, you must be safe. And of course, we need to have built environment so that our livelihoods and our life outcomes are better achieved. Good housing, good services, good recreational space, so that we will improve our physical activity. The environment, as good as it is, and as supportive in our achieving our life outcomes, also has its consequences, which unfortunately are man-made oftentimes. Most of the problems in the environment, man is a major culprit, and man is a great contributor to the problems. We have respiratory diseases, which are from pollutants or toxicants, and these get into our respiratory systems, causing severe respiratory conditions. So we need to have a good air quality around us to reduce the respiratory diseases we have. We have risk of waterborne diseases, quite a number. The cholera, diarrhea, dysentery, hepatitis, typhoid, food poisoning, just to mention a few, come from water and foodborne diseases. And then we have natural disasters we see around, the monsoons, the fires, all the crashes and all the collapses we have around. So we have these problems in the environment, and they have a direct consequence on our health and life outcomes. So what is environmental health assessment? This is a process of identifying, evaluating, and mitigating environmental risk to human health. It involves measuring pollutants, determining the risk, conducting individual or home or community assessment so that we know what is the sources of some of these pollutants or some of these poisons or some of these toxicants. And once the sources are known, it's easier to address. There's a link between human health and the environment, and systematic evaluations need to be carried out so that population health is better understood. We need accurate measurements to identify sources and also monitor trends and plan regulatory actions to promote health and well-being. An environmental health assessment can be used to estimate the probability that within a certain time frame an adverse health effect can come or can occur, and also determine what type of pollutants people are exposed to, either in water, air, soil, or food, or whether it's microbial, or whether it's a physical hazard, or whatever other condition that may be affecting populations. And the purpose of our assessment is basically to identify the possible effects and suggest remedies to deal with it, as well as predict if these remedies will be successful. So it must follow an organizational platform. Government, decision makers, policy makers, stakeholders are all involved in providing support and systems that this environmental assessment will achieve. And of course, the reports of this assessment are read by these people, and certain actions that are needed to address them also taken. So what is the benefit of environmental health assessment? To reduce costs of project and time of project implementation, to see how modifications can be done, to increase project acceptance, to avoid impacts and violations of laws, as well as improve performance, and should there be spillages or damages to the environment, see how cleanups can be done and apply costs to them right from the beginning. So environmental health assessment to give us a healthier environment, we improve human health, we maintain diversity, we decrease use of resources so that resources are conserved, and also conflicts are reduced and community participation enhanced. we have these goals in environmental health assessment: identifying the risk, determining the causative agent, knowing whether these conditions in which this agent exists are what will propel further damage or will be curtailed should a certain intervention be put in place. So we need everyone to know what people are exposed to, what the agents are, where they are coming from, who is affected, and how these presentations are seen in persons affected. So we need socioeconomic development and innovation approaches to promote environmental health assessment and improve the health and well-being of people and the general public. The timing of an environmental health assessment depends on the health emergency at hand and the information available. So we need early investigation and early collection of data and specimens so that action is taken, and if there's an outbreak, it is curtailed before there's a widespread. But if there is no clue to the source, it may be difficult and it may be wasteful. So we need quick responses and timely interventions during environmental assessment. Like I've explained, we need to identify the hazards, we need to describe what the hazards are and what harm they are causing. This is more like epidemiological studies. The who is affected, where it is affected, what is it causing, when did it happen, the seven W's and H, which explain in epidemiology. So these are factored in during environmental health assessment. So we have some of the sources of information we look out for during environmental health assessment is product information. For example, in the case of hazards, what type of products are they? What are the written policies concerning such product use in our environment? Who is affected? What groups of persons are affected? Young, old? Maybe you carry out some interviews and focus group discussions. There might also be laboratory testings of specimens and testing of persons affected as well, so that a holistic information is obtained. So steps in environmental health assessment: you monitor the environmental health and status to identify the people affected or the problems presenting. Does this community have an environmental health and needs assessment ever been done? Is the community updated in its environmental health assessment in the last 3 years? What are the health trends in that community? So you ask basic information just to get some baseline data. And then you diagnose and investigate the problems. Who is affected? What happened? Where did it happen? When did it happen? Is it seasonal? Is it periodical? Is it perennial? Is it annual? So how this information helps you in drawing to a conclusion. What is it? Then you inform and educate people. This is the point where some reports are obtained and certain policymakers or certain stakeholders are also brought in and presented with the information found during the baseline data, and action is taken. And of course, you mobilize the community partnership to solve the problems found in the community. So we also have some videos on environmental health and safety which you can watch and get better understanding and be equipped to protect or do an environmental health assessment. So carrying out an environmental health assessment gives you opportunities in monitoring the environment and having a better understanding of problems in the environment and taking actions to prevent spread or more harm being done, and preparing reports that will guide policy. So environmental health assessment is a call for action. It's everyone is entitled to an environment conducive to highest attainable health and well-being, and there must be adequate information, decisions and activities that will protect the environment and health of well-being. And everyone has a responsibility to contribute to protecting the environment as well as participating in decision making regarding health and safety of the environment. So an environmental health assessment will help us in addressing problems in the environment, breaking transmission patterns, and helping to solve future problems of the environment, as well as providing solutions to what can best be done to promote health and safety, or environmental health and safety. So, like I said, we need to be very prepared to promote health of the environment, as well as contribute to our local conditions in the environment to experience a good daily outcome. Our last session is healthcare waste management. Healthcare waste management. Um, Healthcare waste management session, we're expecting that you will understand the sources of healthcare waste, or list the types and sources of healthcare waste, enumerate risk associated with healthcare waste, explain the processes of managing this healthcare waste, and make informed decisions protecting of our communities from healthcare waste. So you should be able to appreciate that there are risks associated with healthcare waste, and also provide guidance or policy statements that will prevent communities being affected by healthcare waste. So what is healthcare waste? Healthcare waste is medical waste, which can be solid or liquid, but is generated from healthcare facilities. WHO defines medical waste as waste generated by healthcare activities, ranging from used needles and syringes to soiled dressings, body parts, diagnostic samples, blood, chemicals, pharmaceuticals, and medical devices, as well as radioactive materials. Biomedical waste or hospital waste is any kind of waste containing infectious materials generated during the treatment of humans or animals, as well as during research involving biologicals. What are the types of healthcare waste? Of all the amount of waste generated by healthcare facilities, 85% is general waste, while 15% is is hazardous waste, which can be infectious, toxic, or radioactive. Remember, we have all of so much going on in healthcare facilities. So medical waste can also be classified under types. The infectious waste. This contains waste that can carry materials that can transmit from one person to the other, and they are handled with care. This could be swabs, bandages, or disposable materials from animals or from patients. And then we have the pathological waste, which are human tissues, organs, or fluids, or body parts, or carcasses of animals used in research. Then we have the chemical waste, which are the solvents used. We have the pharmaceutical waste, which could be expired or used or adulterated drugs and vaccines. We have the cytotoxic waste, containing genotoxic or highly hazardous substances that can cause mutation or cause carcinogenicity. And oftentimes, these are substances used in the treatment of cancer or the metabolites of these substances. Then we have the radioactive waste, used during radioactive uh, radiotherapy and other um, radioactive procedures. The 85% we have are the non-hazardous waste, which are normal waste we get maybe from beddings or um, medical devices used. So just a pictorial explanation of what medical waste is. We have the mercuries in thermometers, and we have the syringes, the needles, the gloves, the face masks, the plastic bags, the blood bags, the tubings, and all of it. So typically we have the clinical waste, the infectious waste, the radioactive waste, the pathological waste, coming from different arms of a health facility or a research laboratory. The slides will give you better explanation of the classification of healthcare waste we have. Recyclable, some materials can be recycled. Common waste, which oftentimes are not very effective. Then the infectious waste, and the anatomic waste, and the hazardous waste. So waste are also classified by class as well as types. What are the sources of healthcare waste? We have homes, hospitals, nursing homes, and healthcare facilities. We have the laboratory centers. We have the mortuaries. We have the blood banks. We have the research laboratories, and many other places where health care is provided. So what are the environmental risks associated with healthcare waste? Healthcare waste, if not treated properly and dumped in landfills, can cause contamination of surface water or groundwater. Healthcare waste, if not properly disposed and oftentimes burnt in the oven, can produce toxic pollutants into the environment. And some chemicals that are from the healthcare waste can leach into the environment and affect environmental organisms that are needed for maybe agricultural activities and all of it. So there are environmental problems from healthcare waste if it is not properly disposed. Then we have incineration, which causes pollution and release of heavy metals. Remember, mercury is one heavy metal that is oftentimes very available in healthcare waste. Broken thermometers have a lot of mercury in it, and if these are just incinerated, we're releasing heavy metals into the environment. So how do we handle healthcare waste? The key to effective management of healthcare waste, first step is segregation. Remember, so much is generated at the same time, so we need to separate it into plastics, into cotton, into tubings, and all the various types. They have to be sorted according to types. So also the containers in which they are put are also the first step of sorting. We will be discussing that the healthcare waste are sorted out even at the point of generation. So the various containers in which they are put in helps the sorting and the segregation so that all is not jumbled together. So we have color codes for healthcare waste, and this explains it. Black is non-infectious healthcare waste. Yellow is infectious healthcare waste. Red is highly infectious healthcare waste. While white is for sharps. So in a health facility, you must see these colors of containers. And this, of course, helps when the healthcare waste is to be managed, because you will know what to take from each container and the associated precautions to take when handling them. Another pictorial example of how the healthcare waste is generated. General waste is in green, where we have the kitchen, tissues and water bottles, infected glassware and sharps. Red is for infected, not sharps. Sharps are normally put in white containers. So transporting healthcare waste comes in two ways. You transport within the facility and you transport out of the facility. Within the facility, you move from the point of generation to the point of collation. So there must be a point in the facility for collating or healthcare waste, and then transporting to a bigger point outside the health facility for disposal. So healthcare waste is removed every day from the area of generation. You could design a schedule of removing it from the point of generation and then moved within the facility to the point of collation. So you need to understand the various dressing and the various procedures you need during movement of healthcare waste within a facility. These have to be labeled properly, and the containers in which they are transported also must be properly labeled. Then you transport outside the facility. So you are some waste that are transported outside the facility are transported in designed vehicles, clearly marked biomedical waste or healthcare waste, or a sign to indicate on the vehicle that it is carrying healthcare waste. So this is the type of vehicles that move healthcare waste around. And you can see this is carrying a yellow containers, which means they are infectious waste. So some of the signs you see on containers or on the vehicles moving the healthcare waste will tell you what type of waste. For these three rings, this is a biomedical waste being moved. So of course, this is highly hazardous. And so you need to understand the transportation procedures. And for this, what you are expected to be kitted with when handling healthcare waste. Of course, PPEs are very important. Your nose masks, your face masks, your apron, your long gloves, and your boots, so that there is no situation of contact between the persons moving the waste and the waste. And everyone is carefully guided to ensure that you don't have secondary contamination from you handling such waste from a facility. It's important. This is very made available in our facilities. But I wonder if we do have them. This we will discuss. So, some of the policies on healthcare waste. The federal government's National Healthcare Waste Policy of 2013, the Basel Convention of 1989, which controls transboundary movement of hazardous waste, including medical and pharmaceutical waste, United Nations Special Report 2011 on management and disposal of medical waste, technical guidelines, and the Stockholm Convention to protect human health and transboundary movement of medical waste. So we will discuss how, as environmentalists, you will recommend to the government standardized healthcare waste management processes in the Nigeria. So this is another discussion session for us. Let's share ideas on how we can propose a better handling of healthcare waste in our facilities. And you will watch these videos and probably get more insight into the healthcare waste management in Nigeria. So I just want to thank you for this session, and going through the slides after my presentation, you will have better understanding. Thank you very much.